APC Community Services, Kingsbrook Jewish Medical Center, My Time Inc., and BMS, Brownsville Multi-Service Center. I want to welcome you to our 7th biannual Caribbean Health Summit. We know that in the Caribbean community we have many challenges, but we want to arise to the occasion and look towards solutions. It's good to identify problems, but if you identify problems and you're not working towards solution, you get in a state of apathy, despair. But we are people of resilience, aren't we? Even though we are few here this morning, change only begins with one. If everyone is committed and is willing to do something, then we can make a difference. So I want you to see yourselves as change agents. I didn't come up here to make a speech, by the way, but I'm speaking from my heart. And so I welcome you and trust that this will be a very productive dialogue, and that going forward, we'll be able to put some strategies in place so we can deal with these various challenges that we are faced with. We know that during this conference, we will be focusing on mental health, and we all know the stigma surrounding mental health. We also will be looking at the opioid epidemic and what we can do about it in our community. We'll be looking at suicide prevention as well as gun violence and how we can equip our young people so that they won't get so involved in these gangs and killing themselves and killing others. So, as we focus on those topics, we have some wonderful presenters, but it's my distinguished privilege to introduce to you a very good friend and a colleague, Miss Enid Dillard. She is the Marketing and Public Relations Director of this facility, Kingsbrook Jewish Medical Center, and she is our facilitator for today. Make her feel welcome, please.
Dr. Emmanuel, and thank you all for coming. Working at a facility like this is very important to me. I was born and raised in the community. My parents are from Guyana. I'm a first-generation American, which means I'm not American at all. But it's very important that when you work in a facility of this magnitude, where you're interfacing with so many Caribbean people, that the institution itself has a sensitive understanding of cultural sensitivity. And so working with someone like Dr. Emmanuel over the last, I would say, 7 years has been so instrumental to me and my work here to making sure that we're tapping into the things that are most relevant in this community. And sometimes as a big box institution, we can become very locked into our own ideals. It's only until we're reaching out into the community and getting a more sensitized understanding of what the real issues are that makes us a more vibrant organization and more responsible and efficient organization. So doing this summit is extremely important to me. I'm so glad to see you all here. And Dr. Emmanuel stole my program. And at this time, we'd like to introduce our keynote speaker. We're so glad to have her, Dr. Tamara Boyce. Dr. Boyce is the lead physician and co-founder of Big Apple Medical Walk-in Urgent Care. She was born and raised in New York and received her undergraduate degree in sociology from the University of Virginia. She received her undergraduate degree in sociology from the University of Virginia as well. She obtained her medical degree from the University of Medicine and Dentistry of New Jersey School of Osteopathic Medicine and completed her emergency medicine residency in 2009, at St. Joseph's Regional Medical Center in Paterson, New Jersey. So we welcome her today. Give her a warm round of applause, Dr. Tamara Boyce.
Hi, good morning. Thank you, Enid, very much for the introduction. My name is Tamara Moise. It's a pleasure to be here to talk to you all. I am an emergency medicine physician. I've been practicing emergency medicine in Brooklyn for almost 10 years. Like Enid said, I'm the co-owner and medical director of Big Apple Urgent Care here in Brooklyn, in East Flatbush. And I also work in the emergency department at Brookdale Medical Center. It's truly a pleasure and honor to speak to you guys today. I would just like to acknowledge Dr. McLean. Thank you for having me here. And then also I'd like to thank Dr. Torian Easterling from the Department of Health for recommending me to be the keynote speaker today. If there are any officials here from the community, we do thank you for being here today and supporting our Caribbean community. I was asked to speak about some troubling issues that we have in the community, such as gun violence. We're also going to speak about mental health, substance abuse, and immigration, and basically how these issues impact our physical health. This is what I was asked to speak about today. I am going to give some interesting stats on these issues and how these issues affect our bodies from a medical standpoint. And later, I will speak about some of the ways to deal with these issues, some solutions. Just as Dr. Minkin had mentioned, it's very important to have solutions. First, let's talk about gun violence. Firearms are the leading cause of morbidity and mortality in the United States and accounted for 36,000 deaths and nearly 85,000 injuries in the year 2015. This was published in the Annals of Internal Medicine in 2017. Gun violence has an obvious impact on physical health, especially morbidity. Working in the emergency department, I've seen this firsthand. My patients, who unfortunately are typically young adults, have suffered from many different life-altering problems, such as some of these folks lose their limbs, they lose their arms, they lose their legs, they're wheelchair-bound, and these are young folks and they can no longer fend for themselves as young people. Also, these patients wind up having permanent brain injuries to the point where they may develop seizures and have seizures for the rest of their lives, or they wind up having declined cognitive function to the point where they cannot get a job, they cannot finish school. Gun violence also affects the abdomen. You can have abdominal complications if you were shot or stabbed in the belly. And you can wind up with something called small bowel obstruction, which basically requires repeated surgeries throughout the rest of your life. And then also too, you wind up with generalized chronic pain throughout your body wherever you got shot. And guess what? That leads to opioid dependence sometimes, because this is pain that you have to deal with for the rest of your life, and sometimes folk wind up going to heroin on the street, or they're abusing or getting addicted to prescribed opioids. So the long-term effects of being a victim of gun violence is quite profound. These injuries prevent these patients from getting a job, from taking care of their families, from just taking care of their basic needs. So quality of life is a huge problem when we talk about gun violence and its effect on one's physical health. So next, let's talk about mental health. So how does mental health impact one's physical health? So there are some correlations between mental health and physical health that one may not realize. So people with the highest levels of self-rated distress are 32% more likely to have died from cancer. In addition, depression has been found to be associated with an increased risk of coronary heart disease. So there's actually a connection between depression and heart disease, whether it's heart failure or whether it's heart attack. And schizophrenia in particular, which I'll speak about later, schizophrenia is associated with double the risk of death from heart disease. And schizophrenia is also associated with 3 times the risk of death from respiratory disease. So there's a lot of connection here. It's not just mental illness affects the brain. It actually does affect the body in many ways. So this is because people with mental health conditions are less likely to receive the physical health care that they're entitled to. Mental health service users are statistically less likely to receive routine checkups, which will prevent them from having these physical ailments and diseases in the first place. So they're not as likely to be offered to be giving up smoking and to reduce alcohol consumption and to make positive adjustments to their diet. So mental health definitely has a negative impact on one's physical health. So now let's turn to substance abuse. So with substance abuse, let's start with some alarming statistics. So number one, heroin addiction. Heroin addiction among young adults between the ages of 18 and 25 years old has doubled in the last 10 years, and that's according to the AARP. Secondly, over 900,000 American adults, we're talking almost 1 million adults, over the age of 11, have struggled with a cocaine use disorder, and this was in the year 2014. So here's the worst stat, in my opinion, and you might have heard this in the news recently. Every day in the United States, 115 people die as a result of opioid overdose. And another 6,700 are treated in the emergency department for their misuse or abuse of drugs. This is every day, 115 people every day. So clearly, substance abuse is truly an epidemic in the country, and of course it's an epidemic in our local community. So when we speak on the topic of substance abuse, it's important to realize that drug abuse not only affects the brain, you're not only getting high, but it has negative effects on multiple systems and multiple organs in your body. It's not just the brain. So for example, drugs affect the cardiovascular system. The cardiovascular system suffers greatly from drug abuse. One can have a heart attack or even cardiac arrest from the use of cocaine. The abuse of alcohol can cause something called cardiomyopathy, which is a heart condition that leads to heart failure and eventually death. Drugs also affect our GI system, the gastrointestinal system. Opioids actually can cause severe constipation to the point where one can have permanent damage to the colon and the rectum. And of course it also has a bad effect on our respiratory system. Heroin use and opioid use can cause you to stop breathing completely, which can kill you instantly. So this is what we're seeing on the news. This is why we're seeing folks who overdose on opioids die so quickly. And then also you have those who are smoking crack and cocaine. This does something else to the lung. It actually causes severe damage of the lung itself, to the point where someone could wind up being on an oxygen tank for the rest of their life. Or smoking crack and cocaine can also cause lung collapse, which is also life-threatening. So in the emergency department, I've had to intubate multiple patients due to the use of opioids, which means that I've had to place a tube into someone's windpipe and connect them to a breathing machine. And this is because they can no longer breathe on their own, because this is what opioids do. Opioids actually takes your drive away to breathe. And this is what makes opioids so deadly and so dangerous. So simply said, substance abuse truly has a negative effect on one's body, from head down to your toe. So next, let's switch gears and talk about immigration. And let's talk about health issues in particular that immigrants have to face, especially undocumented immigrants. So immigrants unfortunately do not have access to government-supported health programs like Medicaid. And they're also pretty much banned from private health insurances because they cannot afford that. And they're sometimes exposed to toxic chemicals and workplace safety issues that can cause or exacerbate chronic health problems. So most concerning to me is that undocumented immigrants are actually afraid to go to the hospital. They're afraid to go to the hospital to get care because they're afraid that immigration is waiting to detain them there, or that the hospital staff might actually deport them. So I've actually experienced this firsthand. I've actually had undocumented immigrants who were in distress and could barely speak to me, but at the same time asking me if I'm going to report them to ICE. So instead of them telling me their ailment, so I could actually help them out, the first thing they're thinking about is getting detained, which is not right. So I have to remind these patients that I'm there to help them and that I have absolutely nothing to do with immigration, that I'm just here to treat their issue. So the other problem with this situation is that if they're not wanting to go to the hospital and they don't have a primary care doctor, then that means that they're letting their medical condition fester to a very dangerous level. And this is not their fault. They're scared of immigration and they're scared in general. So therefore, it's safe to say that immigrants are clearly at a higher risk of morbidity and mortality. Your health truly suffers when you don't have access to preventative care and when you're actually afraid to go to the emergency department. So the difficulties that immigrants, especially undocumented immigrants, have to go through truly have a negative impact on their physical health. So we've talked about quite a few issues and problems in our community. So what can we do to generally address these issues that are plaguing our community? So with all of these negative statistics, let's try to look on the bright side. Let's try to look into some solutions. Personally, I think we can change some of these things. We can't change everything, but there are some things that we can change. We, the West Indian community, we're hard workers. Some of us are working 2 to 3 jobs to provide for our families. Many of us come to the States with very little and wind up building up successful businesses and having successful careers. I'm first generation Haitian. My parents came from Haiti in the early 1970s. Not only did my parents make something of themselves from very few resources, but they also found a way to raise me to become just as hardworking as they were. So as a resilient, hardworking immigrant community that we are, we've been able to overcome so many challenges. So I know we can address and overcome some of the challenges that I've spoken about today. So some solutions that I'll be discussing are representation in the workforce, prioritizing mental health, and lastly, minority business ownership. So first, let's talk about representation in the workforce. So in the West Indian community, I think we've done very well in terms of prioritizing education, we're very good at that, and pursuing careers in health professions. Many of us are physicians, we're nurses, we're physician assistants, we're respiratory therapists, and much more. And this is a great thing. However, we also need to be represented in science, technology, and research. We can't forget about this. There are new technologies being created every day that are improving health, and we need to be a part of developing these innovations so that the issues in our communities can be properly addressed. So why is this so important? A great example is sickle cell disease. This is a disease that specifically afflicts our community. So unfortunately, we don't have a cure for sickle cell, and this is why we need to be more represented in research to ensure that our disparities, our diseases are being studied and being prioritized. I read an article in Forbes magazine that asked the question, why do many minorities avoid science? So in this article, they talked about the fact that blacks are very underrepresented in the fields of science, technology, engineering, and math, which is also known as STEM. So surprisingly, the U.S. News and World Report recently noted that the United States STEM workforce is no more diverse than it was 14 years ago. So we have made absolutely no progress in this realm. So this is something we very much have to work on. So what I got out of this article is that we need to expose our children at a very young age to science and technology so that we can excel in STEM in the same way that we've excelled in the health professions. After all, careers in science, technology, engineering, and math, they all represent jobs of the current and future workforce, and we can't be left behind. In addition, getting involved in these fields can truly make a difference in our communities. This is exactly how we can get involved in addressing some of the issues that I spoke about earlier, like finding a cure for mental illness, for addiction, finding a cure for medical diseases such as sickle cell disease, diabetes, cancer, all these horrible conditions that are plaguing our community. So next, let's talk about mental health and prioritizing mental health, especially in our community, okay? So this year alone, in 2018, there have been over 6.8 million Black Americans that have been diagnosed with mental illness. 6.8 million. Some of us don't take this seriously. And this is 16%, this 6.8 million number is 16% of the entire Black American population in the US. In addition, Black Americans of all ages are more likely to be victims of serious violent crime than whites, making them more likely to meet the diagnostic criteria for post-traumatic stress disorder. Blacks are also twice as likely as whites to be diagnosed with schizophrenia, which I didn't even know that. So for many African Americans who want to discuss the impact of racism on their mental health and physical well-being, finding a mental health practitioner who's culturally competent is so vital to their healing. Unfortunately, only 2% of psychiatrists and 5% of psychologists are African American in this country. So to address this accessibility issue, there needs to be more recruitment and training of Black mental health providers. It's so important to encourage our youth to consider looking into this profession, despite the stereotypes that we have about mental illness. This is yet another opportunity for us to take control of an issue that afflicts our community and help ourselves overcome this issue. So mental health is such an important problem that even our former First Lady, Michelle Obama, I'm sad that she's the former, she addressed the need to reduce the stigma of getting professional help when needed. She said, and I quote, "There should be absolutely no stigma around mental health. None, zero. It's time to tell everyone who's dealing with a mental health issue that they're not alone, and that getting support and treatment isn't a sign of weakness, it's a sign of strength." So, especially in our Caribbean community, we have to stop stigmatizing and ignoring mental health issues. Unfortunately, our culture does not take mental health seriously enough. I think things are changing, but we still have a lot more work to do. God forbid someone in our family has bipolar disease. We hide it from the rest of the family, we choose not to deal with it, and then bad things happen, such as suicide. We need to treat mental health just like any other medical condition. We should not treat the brain any differently than we treat the heart or the lungs or the kidney. The reality is that cultural shifts do take time, but we truly need to make an effort to change our mentality. Otherwise, we're going to continue to lose our loved ones to suicide when something could have been done to prevent these tragedies. So lastly, I'd like to speak about the importance of minority ownership of businesses. So coming from a medical standpoint, I've come to find out that Black entrepreneurship is crucial in the world of medicine. A recent paper from the National Bureau of Economic Research has indicated that African American men are more likely to feel comfortable with and take health advice from doctors who look like them. The findings also suggest that increased health screening by a more diverse physician workforce could actually help close the life expectancy gap between white and Black men. So here in Brooklyn, we're blessed to have a strong entrepreneurial spirit in the West Indian community. But we need to extend it to more ownership in healthcare and technology. I started my own urgent care because I saw the need for high quality urgent care in our community that's owned by us. So in the neighborhood where my urgent care is located, right here in East Flatbush, nearby in East Flatbush, many residents travel to the city to Manhattan to get their health care. So I wanted to create a modern, large, clean office space where patients feel comfortable, they feel valued, they feel heard. Our hardworking community deserves this type of a medical setting, but unfortunately we don't always get that. So this is why I co-founded Big Apple Urgent Care with my partner Watson Phillips, who is also Haitian. In addition, as I've been practicing in the East Flatbush community, it's obvious that the community appreciates the fact that we look like them and that we even speak some of their languages. We know how to serve this community, and the community is happy that we're here. We truly understand the importance of Black entrepreneurship, and we want to help reduce health disparities and improve health care for everyone. So, I hope you were able to gain some knowledge on some important issues that affect our community from a medical standpoint. And I also hope that I encourage you to think about some helpful ways to address some of these issues. It was truly a pleasure to share my stories and to share my thoughts with you all. So thank you again, and enjoy the rest of the summit.
Let's give Dr. Boyce another round of applause. That was fantastic and quite informative. At this time, we'd like to introduce our panel speakers and have them take a seat up front. We have Lucinda Clark. Give her a warm round of applause as well. Her subject will be autism. We have Marcia Skeet, RN, from Kingsbrook Jewish Medical Center, Psychiatric Department. We have Ms. Alice Blair, and her subject today will be sexual assault. Let's give her a warm round of applause. And Mr. Brett Scudder, who will be discussing suicide prevention. And do we have any questions for Dr. Boyce before she leaves? Anybody have any questions for her?
Can she stay?
I asked her. She's going to try. She'll stay for a little bit. Okay, at this point, let me just go through a little bit.
You have a gentleman right here.
Oh, just want to know if your what the scope of your urgent care, like how many kinds of concerns or health concerns do you address?
Yeah, sure. The urgent care, what she had asked was what medical issues we address at our urgent care. So we are basically a mini ER in a sense, but we do deal with all complaints, from women health complaints, from cough and colds, from fall if you sprained or broke your ankle, because we actually do have we have X-ray capability at the urgent care. Also, if someone cannot get an appointment with their primary doctor and they need a prescription refill, we can take care of that as well. So those are but we do a whole lot more, but those are the main things that we do. We actually do have some flyers in the back that have more information as well. Yes.
Insurance.
Insurance, what kind of insurance?
Okay. We actually, since we're a new facility, we're in the middle of accepting more and more insurances. So we do take pretty much the main insurances at this time. But you can give us a call, and you can give the office a call, and we can see if we take your insurance in particular.
I have a question about entrepreneurship. How do you encourage the blacks to be involved in your businesses?
How do you encourage the blacks to be involved in more businesses?
Well, by doing talks like this. This is a big thing. And just the fact that I've opened up my own urgent care, I've been trying to get involved more in the community to get the word out there. Just by seeing me do this, hopefully is an inspiration. But I do make an effort to go out to the community. I also do get involved in going to schools and speaking to the kids about getting involved in owning, their own businesses in the future. So that's pretty much how I've done my part with that.
One obstacle in entrepreneurship is capital. Difficulty in acquiring it. What part do you play
In terms of raising capital?
advising how to?
Well, that's a tough one because, of course, capital is a big issue. We're not a people where we have generations of money to help us out, so things are not easy. But I think the best way is to make sure that we're encouraging our youth to get into professions where they can build money whether it's through medicine, whether it's through finance, so that you can eventually open up your own business. So it's just all about trying to encourage our young ones to get into positions in life that will pay them well, so that they can build up that money and then, start their own businesses and eventually make it generational, just like the Jewish do, and just like some other people do. So yes, ma'am.
Hi, I currently work at a home care agency, and we have like a lot of home health aides, personal care aides that we used to normally send them to like the AG urgent care, but what they normally ask for, like, hey, we can't do your physical because you have to change your PCP to our PCP that's here on site. So how do you guys actually operate when it comes to someone just walking in and doing a physical?
We actually are not a primary care office. We do urgent care. So if someone needs to get a physical exam, we can just do it right away. It doesn't matter because we don't have primary care docs at our facility. So that would never be a barrier. So if someone needs a physical exam, they just come and we do their physical exam. Thank you so much, guys.
Thank you again, Dr. Boyce. So at this time, we will start our panel. I'd like to start with Marcia Skeet. She is our RN nurse educator here in the Department of Psychiatry. And she's just going to sit and talk a little bit, piggyback off of Dr. Boyce a bit about the mental health taboos in our community. So let's give her a warm round of applause.
Good morning. Thank you. I just would like to talk a little bit about the fact that in the Caribbean, and for us as a group of Caribbean people, that mental health is a silent epidemic. It's second to being people can think of it as being cursed, or it's shameful, or it's stigmatized. We hear the word stigma a lot, and of course we can pretty much agree to the fact that people who have mental illness do get stigmatized. Mental illness is the most construed and mistreated illness in the Caribbean. And of course, when you first come here, you bring with you your culture, your thoughts about what illness is and how you treat it. And we don't necessarily change our cultural practices very easily. They're very enduring. And we know that mental illness is not allowed to be acknowledged. When you're part of the Caribbean community, especially if you've attained some status, you're not letting people know that you have someone mentally ill in your family. That is more common than we might like to acknowledge. Many times we see mental illness as being too expensive to seek help for. We have to have money for other things, and this is not what is our problem anyhow. We can deny it, we can hide someone away with it. We do things that does not allow the person to get help. It's easily discriminated against. Some people will say, well, where I'm from, if you're mentally ill, you just put you away. And sometimes folks don't visit even their own children in hospitals because they have a mental illness. If you've attained some measure of success in the community, you definitely don't want anybody to know that someone close to you has a mental illness. Now, 60% of mental health patients are less likely to receive care than the general population. Mental illness is a chronic ailment. If you have diabetes and you don't treat it, it will become worse. If you have hypertension and you do not treat it, it will become worse. So it is with mental illness. You do not treat it, it becomes worse. 80% of people will have no mental health care access. It's a very difficult problem to manage if we continue to deny it as a group of people. We've heard from the doctor, we've heard from the keynote address that so many persons with mental illness wind up with all kinds of physiological illnesses, or depressed people, they have headaches and backaches, and they go to work maybe and come home and crash out. If you're going to work and you're coming home, people feel comfortable about that. A lot of the time, after all, you're working, you're productive, you're a very productive group of people. Doesn't matter that all you did was lay on the couch until you got up, went to bed, and then came back to work. People don't recognize these symptoms enough, and we don't treat them well enough. And of course, we know if you don't, they will become worse. Networks of peer counseling and support groups and mental health workers are available, but people do not access them very well. Research projects are needed, and new approaches are needed for us to help people to think about what it is we're going to do to decrease this problem. Holism is needed to address the needs of the patients. You've heard that a person with schizophrenia has many more possibilities of dying. Of course, we know that person does not get physical help. Many times they're paranoid. They don't want to go to the doctor. So with the paranoia and not being treated, they will have a greater possibility of death. Physiological ailments are not only sometimes based on the person's thinking, they're not going to the doctor because they're paranoid. Family members aren't taking them to the doctor because, after all, it's a weakness and a thought of being a weakness rather than an illness. When we do research on people who need to be in charge of and make access for people with mental illness, ministers in the Faith Project, they'll say things like, this is a weakness, and if the person had more faith in God, they would not be in the condition that they're in now. Certainly, faith is important. Spiritual distress is a real critical part of whether you feel healthy mentally or not. However, then if you have diabetes, you don't say you're going to pray it away. If you have hypertension, you're not going to say that you're going to pray it away. You certainly will pray, you certainly will maintain your faith. However, you will get care. We need to be able to help our faith-based communities think that way some of the time. People talk about being Caribbean, you're strong, you're able, you can do this and you can do that. But if you get mentally ill, that particular way of thinking lets people put people in the closet. We know that stigma is a worldwide thing. I happened to be in Morocco, and I was there for 3 weeks. For the whole first week, I did not know there was another person living in that house. The person had a mental illness. Then someone took a tray to her in the room where she was, and I realized that she was there. It was a very uncomfortable thing for the whole family. The very next day, they sent her to another state to one of her sisters, because I wasn't supposed to see this lady. Now, I can't say that we are very far away from that. Being born and raised in the Caribbean, I know that people will hide that person a lot of the time. They are sicker and sicker because they don't get help. Come to the United States, we do a little better, but usually over time. So your new immigrants and ones who come have problems with adjusting to the country, have difficulties with all of the things they worry about, and especially if indeed, as mentioned, that person has concerns about immigration and being deported, you've got even more problems. So we need to be a group of people that take this situation in hand, look at it, come up with solutions, and help people more. There are certain circumstances whereby people won't go to the community person, the healthcare community right here, let's say in Crown Heights, where we have a large number of Caribbean people. By the time they do seek help, they're so far removed from what they really need. They wind up in a hospital, they're in a long-term care situation, which they did not need to be in, and now they're being treated by people who do not understand their culture, their values, or their system. Should we be stronger as healthcare providers in our community for mentally ill people, we would have better care for our patients, for the people who are in need. So, someone said that the stigma essentially grows itself. It is almost self-perpetuating. The more it goes on, the less we talk about it. The less we talk about it, the more it goes on. And therefore we have these problems where people are not talking about the fact that somebody has some unusual symptoms. Sometimes we think that solutions are, oh, this boy who is acting very strangely after he's gone away to school and decides, well, I've got to come home now. I'm going to be away for a little bit. I just need a little break. And doesn't go back to school, sits around in the house, and becomes more and more inactive. The parents say things like, oh, he just needs to get married, have a life, and I will tell you that the cure for mental illness is not marriage. It might make it worse. So be proactive, unless you're married to the doctor. And I'm sure she doesn't want a patient for a husband. So stigma reproduces. Instead of telling people to seek mental health services, we might have some faith-based persons who will say prayer, fast, do an exorcism, for which people often deny needed medical care. So pastors why would I bring up pastors? Pastors are usually the people that people will talk to when things go wrong in the family. And so people with mental illness might go to them. And they feel obligated to talk about God and what God will do. Certainly they could use education also as to what actual medical and physical care can do. So we as a group of people have an even bigger responsibility. The person may be becoming ill right in front of us. Please take them, help them, support them. If they get sick, please visit them. And that's all I'll say for now. I thank you all for allowing me to be a part of the program. And I hope that you will consider some of these suggestions that we work with the patients.
At this time, I'd like to introduce Ms. Alice Blair, RN. She has been an employee of New York City's Health and Hospital Services since 1988. She began her career as a registered nurse in the Adult Emergency Department, a Level 1 trauma center. After completing her master's degree as an advanced practical nurse in 2003, she began working as a nurse practitioner in the fast track area until she took on her current role as a senior management consultant, which involves the coordinating of the Brooklyn Sexual Assault Response Team for the New York Health and Hospital Services. Please welcome Ms. Alice Blair.
Good morning, everyone. As I sit here, it's a pleasure to be here. At least I get an opportunity to speak to the West Indian community, which I chose a career in the city of Brooklyn here, which I consider a city in itself. I myself migrated here when I was 12. I migrated from Costa Rica, which is predominantly Spanish. I learned English as a second language. And my mom was a single mom, so everyone can imagine that was hard. And like the keynote speaker, I built everything and watching my mom work hard. So having taken on this role, it's one of the hardest roles to take on. Sexual assault in the community that we live in is a taboo. I have done this now for 15 years, literally. Ms. Patterson was at Kings County when I started. She was part of the recruitment that made me take this role. So, and sitting here, I'm telling you, it's the hardest for the community of the West Indians. We have faced family members who do not believe that sexual assault takes place in their community. Mental health, which is one of the biggest force that we have to have follow-up for these patients. When I took over, our follow-up was basically, because we were hospital-based, our follow-up was within the psychiatric department, which I had to change because when you mention to a patient, your follow-up would be in what we call at the time the G building, now it's the Hess building. It's an automatic no, I'm not getting followed up. We then work with Cambia, which is on Flatbush Avenue. It's a follow-up social service driven for, they get all their counseling. And we also have MOUs and with Safe Horizon. So our patients, that's our first line of referrals out. These programs are centered through the city, which is Health and Hospital. Every borough has the same identical project. It's 11 health and hospitals. You'll have 11 identical programs. We use the same charting. And in Brooklyn, the 3 hospitals is Kings County, Woodhall, and Coney Island. My role is to oversee these 3 hospitals and make sure they're being followed by the Department of Health guidelines. Woodhall and Kings County have the 24 hours on call, which my team that I coordinate responds to do all sexual assault that are acute, which acute in the state of New York is 96 hours post being assaulted. We're called out through the operator system at Kings County responding to. Coney Island has the same services for those who are on that side, but they're treated by the GYN department. Services is always available. If anyone has any questions in the community, you can always just call Kings County Operator System and you'll get information. It's the easiest system that I find. Instead of giving personal numbers, just call the 245-3131, the operator system. They will put you on to any, to the START program, and there's always communication. There's always someone to answer for the program. If I am not available, there's someone. It's hard to explain because we have a large, as the speaker spoke about, immigrant population that are undocumented. The difference in sexual assault is that if you're undocumented, you're getting the same treatment. All sexual assault patients are paid for by the Crime Victim Act. There's no question asked as far as insurance. They're treated. If it's involved domestic violence, I work straight with the district attorney's office. At the district attorney's office for Brooklyn, we have every task force that is there available. You have help with domestic violence, and if I meet a patient that is a victim of domestic violence with sexual assault, I can reach out to them. They help them with their T visas, any visas that they need, especially when you have domestic violence that are coming out of marriages that there are spouses that marry people and they decided that they're going to literally abuse them because they feel that I have full control. So I want the community to understand, if you come across someone, always refer. You can refer anyone in a severe domestic violence to the district attorney's office. The 15th floor deals with domestic violence. They have an entire floor dedicated to domestic violence. Any victim, male, female, can walk in and request to go to that 15th floor. They will address it and assist them in getting help. And that's something the community does not understand. Brooklyn DA's office also have Project Shield, which is specific for the mentally health community. Any mentally challenged patients that you have, family members, if you have a family member who is, once they reach 18 and you're taking full care of them, you need to file for guardianship. And that's something we don't understand in our community. Unlike medical needs where you can walk in an emergency room and sign for somebody to get a medical physical, if a patient is a sexual assault victim in the state of New York, they have consenting rights. So a mother who has been taking care of their their baby up until 18, now she's 19 and is a victim of sexual assault, cannot sign for that child unless you have guardianship. Because it becomes a dilemma of is it coercion on the parent part? So it's a lot to go to the ER. So I beg of you to always reach out to the district attorney's office and speak to them about, do they have classes, they have lawyers that assist the families in getting the guardianship over your family member. Another project we have is the trafficking within Brooklyn. Trafficking is one of the largest growing problems we have with our young school-age kids. It started as early as junior high. We need to be very cognizant of how we let our children go back and forth from school. This has become a challenge for us. I sit on that task force and we would say, oh, it's not happening in our neighborhood. Ladies, be cognizant when you go to the nail shops and the hairdresser parlors. Look around. You see young ladies that are getting groomed and you always see could be an older person just watching them. Be cognizant. This is what we have. Instead of, back in the days, we had the drugs and we had the gang. Gangs were what we call back then using young ladies as prostitutes and selling drugs. Now they're using our kids as their money-making tool because they take them and they break them out and you can't get your kids back. Because once you get them in the community, they become drug addicts and they keep them, they sell them, and it's a business. We don't know of it, but it's a large population of young people. And it starts in junior high. I can tell you a personal story. My neighbor, my best friend, Tennant, as a daughter, started junior high, and after school she let her wait at the McDonald's for her to pick her up. A middle-aged woman introduced herself to her, and next thing we knew, that child was missing. She's now 17 and has finally, after years of being placed as far as California, they're recruiting her back because they have their contacts. She's now in what we call a lockdown system where she can't go anywhere without a guardian. And that's how you actually can sometimes get them back. But the fear is when she gets old enough, will we be able to hold her back? If anyone ever heard of GEMS, right, that's a group that you can reach out to. GEMS was started by someone who was a victim of trafficking. It's located in the Bronx. Most of these programs are low-key, so you have to reach out to them if they are specifically currently for young ladies. There's not many male programs, but we do have males part of. Another project that we look in is strangulation, that the city is looking into. Strangulation now is most likely will be merging with the sexual assault team in doing victims of domestic violence and sexual assault that are strangled. You hear a young lady says they've been choked out. Keynote speaker can tell you that from emergency-based strangulation is one of the biggest problems we have because there is no protocol as a trauma center to have strangulation. One of my mission is to get protocols for the city of New York to have within the Health and Hospital Corporation. So I spread myself thin because it's not only sexual assault. Sexual assault is what I started out at, but currently I sit in many different task forces. Another one is genital mutilation. Genital mutilation is now a federal crime in the state of New York. As a provider, if you see a patient and she has any genital mutilation, it's mandatory reporting. If you know of a family that sends, let's say the grandmother pays for that child to go to any country and comes back mutilated, it would be the grandmother who would be placed in jail. So, and New York is one of the first states to have that law passed. So, the crime within our West Indian community is there, and together we have to work, because at the end it's mental health. We have to help. If you know someone who is a victim of sexual assault, it's not just a taboo. Reach out to them and help them. With that, I'll wrap up. If there's any questions, you can always, as I said, reach out to the operator. That's the easiest way, and I will get back to you. The operators will always reach out to me and say, this person is calling. Any questions now? Okay, thank you very much.
At this time, we'd like to introduce Ms. Lucinda Clark. She's the Executive Director and Co-Founder, along with her husband, Wayne Clark, of My Time Inc., a support center for parents and caregivers of children with autism and developmental disabilities. My Time Inc. celebrates its 10th anniversary, providing support, educational, behavioral, and recreational workshops and activities to these parents and caregivers. My Time Inc.'s mission is to support, empower, educate, uplift, and enlighten parents of a child with autism and any other developmental disability to live a quality life that they deserve in our community. Please welcome Ms. Lucinda Clark.
Thank you. Good morning, everyone. I would say this is the day the Lord has made. We're going to rejoice and be glad. And I'm very appreciative of Dr. McLean really coming into our community and providing and bringing awareness of the disparities in our community. And when I met her a few years ago, we did an autism empowerment as well, and we tend to look at autism as affecting the children only, but not as the parents being affected. So 10 years ago, when my husband and I created this organization, it's really empowering the parent of a child with autism. And when we look at the perfect topic this morning, of mental health and our parents dealing with our children with autism, and the importance of self-care in doing this. So when she spoke about mental health, I said the best way of looking at it is in self-care for the parent piece. But first, let me explain what autism is. It's a neurological disorder which affects children's social and communication skills. Sometimes there'll be some repetitive behaviors. It's known as a pervasive developmental disorder, NOS, not other specified, because there's so many. That's why it's called a spectrum, autism spectrum disorder. The disorder ranges from low to really high functioning, some of our children. Sometimes you hear about these wonderful children who are autistic and musically inclined, but their social skills and their social development is very delayed. But when you look at a parent having a child with disability, the mental stress that they go through in facing our community, especially our Caribbean community, in having a child with disability. Because it's not something discussed at the dinner table or having a discussion that my child is autistic, my child has cerebral palsy, or my child has some developmental disability. So the strain it puts on the parent mentally in dealing with the family, because as Europeans, we keep everything under hush. This is the closet, it's so quiet, we don't discuss that. Even growing up, when I was growing up in the Caribbean, I'm from Trinidad, I moved here 35 years ago, and I never really got into understanding the world of the special needs. So I educated myself, I got my master's in special education, and I went back to Penn State and I did my certificate of applied behavior analysis to understand the behaviors of the children, but yet understand the behaviors of the parents. Because how we act or we react to a certain situation can make the situation more difficult or challenging for children. And a few years ago when we created My Time, I was looking at how can we help the parents, not only by giving them the strategies to improve their skills in dealing with their children, but also strategies in their mental health awareness. Because it can be very depressing for some families or frustrating when you are told that your child will not function the way he or she should as a quote-unquote typically developing child. And just understanding that I have to raise this child, whether my parent is there, whether my husband is there, my spouse, or someone else, to allow me to raise my child. How can I do this? What is my mental ability? How are you able to face these challenges? And during the course of my work, that's when I met Brett. We started talking about the emotional wellness, because sometimes we don't feel good about ourselves. And then again, having a child with disability, we question ourselves. Because sometimes some parents say, you know, why God did this to me? Is it a curse? Why is this happening to me? What did I do wrong? I am a good person. I've done well. I've, been to church. I'm doing all these different things. But why is this happening to me? And I tell someone, I say to friends, why not you? You know, sometimes we go through things in life that makes us stronger. You know, it gives us the ability to experience things, to share with other people. So by doing this, we started improving our parents' lives by having emotional wellness classes. So we have once a month, we're going to move it to twice a month now. And what we realized, the emotional wellness class was giving them the ability to say, I can do this. I am not alone. I know I can attend our support groups and get the support in a well-trusted environment. Because when you come to my timing, there is no judgment. It's not like, who are you different? Or it doesn't happen that way. We see you as an individual who needs the support to carry on. And as long as we are in that place of showing support and care for someone else, dealing with emotional imbalance and emotional wellness is a safe place. So when we started talking about seeing the parents going through different things in their lives, challenges and experiences, and feeling depressed or feeling, I know we had a parent give 2 weeks ago, you know, coming home from school, coming home from work, like the social worker was saying, doing a great job at work. I mean, she was the fun of the party, she was a delightful person, but when she got home, she was a different person. She had to deal with 2 children with autism. Every day, she gets to the morning, she goes to work, and she's in the health profession, as you were saying. Most of our Caribbean people are nurses or in the health field. I'm the only one who became a teacher. My whole family are nurses. But just understanding that when she got home, I have to deal with this. When her kids are in school or they're away in daycare, she can say, you know what, I am free, I'm at work, I can do what I can do. But when I get home, my whole life changes. She's drinking, she's, taking the pills, just doing things to sedate herself, to pull herself away from situations that she can't even take care of herself. But her solution was finding our support system, finding our support groups, getting the referrals and the resources to know that you're not alone. And when a person gets to understand they're not alone, life changes, mindset changes. One of the things we teach the parent at my time, and deal with emotional wellness, know who you are. Self-care is very important. We tend to forget that self-care is not only about physical care, it's the emotional care, it's the growth and development, and also the spiritual piece. Sometimes we talk, we are believers, or whether you believe or not, there are other things, other forces in this world that guide us to where we need to be. But also how we can put all these elements together for us to be successful in our life. So we talk about self-care, we talk about how can we take care of ourselves as an individual. How am I going to get up every morning with a positive mindset to move on for a new day? And it is so amazing when you wake up in the morning and you set, we use the cell phone for everything. We can use that by creating moments for ourselves to be better. So I know we have a breakout during autism. We talk about techniques. What can you do as an individual to go back, not only as a parent, but even as caregivers and workers, to change your attitude and positive mental mindset. So during our discussion, our breakout, we have more techniques and tips and strategies. So I want to thank you so much for being here this morning, and just enjoy the day. Thank you.
We'd like to introduce Mr. Brett Scudder, and he's the president and chairman of the Suicide Prevention Institute, and Executive Director of SIFIS, Abuse and Suicide First Aid Response and Wellness Center, where he continues to develop his work and his studies in the field of health and wellness, human behavior, psychology, sociology, and socioeconomics, and working directly with people, victims, and survivors on early detection, care, and prevention of human suffering and emotional distress. He is trained and certified in mental health, psychological, trauma, and suicide first aid practitioner who provides services and support to people worldwide. He has other specialized trainings in various aspects of emotional wellness and suicide prevention, which enhances his expertise in the field. Please welcome Mr. Brett Skinner.
Good morning, everyone. Good morning, everyone. Good morning. All right, I know we got fed and we're here, we're breathing, we're alive, right? Come on, we're here, we're alive, right? Well, you don't sound like I'm not ready for this at all. Anyway, mad, sick head, no good. So, I want to say thank you to Dr. McLean for the opportunity. We're here talking about healthcare for the Caribbean, and I wanted to address you from the Caribbean's perspective, okay? I see a lot of people here who may not be from the Caribbean and understand the Caribbean culture, especially talking about suicide. And I want to say thank you to our keynote speaker for addressing what she put in that keynote presentation and how she connected all of that. But let me be real and let me be honest with you. I've been doing this work 16 years in New York City, and the rates of suicide that I'm seeing right now in the West Indian community is alarming. Okay, it is alarming. And it's not alarming because we don't have services or resources or providers. It's alarming because we're not understanding the emotional pain that's driving people to want to die. There are more people living with a fear of living than more people living with a fear of dying. I'll wait for that to sink in for a minute. I'll even take the rest of the time for that to sink in. The reason why I'm saying that, and I see a lot of our medical professionals here, practitioners, I want to say thank you all for the work that you're doing. You're doing a great job. But I really need to empower us as a people and understanding that there are people who do not fear dying. They fear more of living in the pain of the circumstances, the trauma that you're going through, than the experience of dying. When you talk about sexual trauma in our community, we don't talk about sexual trauma, right? And you have many people who have come here and have gone through a lot of hardships just to be here. You have a lot of people who are so afraid of the immigration status right now, even though they have a green card and a citizenship. The depression rates that we're seeing right now in the Caribbean and West Indian community is very frightening. A lot of medical practitioners, I work with a lot of healthcare centers, hospitals, emergency rooms, and the one thing I hear across the board is that you have more people coming in for physical pains and ailments, and they've done every test known to man. And guess what? All normal. But people are hurting, and they're in pain, and they're stressed out, they're depressed, they're hopeless. A lot of them are living in isolation because I don't want you to know what I'm going through, I don't want you to know I have a diagnosis or not. But we need to understand something, that in the Caribbean community, as Dr. Moise was saying, that people like to connect with people who understand the culture. As I said, mad, sick head, no good. How many people know what that means? Well, if you don't know what that means, well, we have a problem right here, right? Right? You're crazy. You know, that's how we normally talk about people who act abnormal, who may not be acting the way we want them to act. And so if you don't understand the culture and how our culture is and how our culture behaves, how then you treat the behavior of that culture and not let the person think that the way you're treating behavior because you don't understand it makes the person feel worse about himself. We're seeing some very scary things in the health and mental health field right now. In April this year, the American Psychiatric Association's report said that doctors and healthcare workers have the highest rates of suicide right now. And they're the ones who are supposed to be taking care of people who need the help. That's even worse for us in the Caribbean and the West Indian community because guess what? Many of us never came from the islands to become doctors or nurses. Many of us came from the islands as doctors and nurses, and we came into a system that does not function the way we function in the islands. And so as you come into the system and how you're providing care in a system that's already conditioned and tell you how to provide care and services, write that prescription real quick. So then here we are adding to the opioid epidemic that we have. We're just starting to educate people in the last couple of years that prescription medication are also opioids. So while many of us have been addicted to opioids for years as a way of treating our pain, we're now starting to say, oh my God, we have an opioid epidemic and an opioid crisis. Now we got to pull back. Hold on, wait a minute. But you, we, and all of us have been So we are going through a very significant shift right now. Right? I talk about suicide from a personalist perspective. I'm Jamaican, I've been here for a long time. I don't have a mental illness. I was not diagnosed with no mental health condition, so please do not ask just because I said I attempted suicide and I wanted to die. First question is, what were you diagnosed with? I was diagnosed with a hard life, struggles to live as a decent human being, a black man in this country. I could list a number of things that are not on any diagnosis spectrum. They are just simply life and wanting to be a decent citizen in this place. But we don't look at those conditions and how those affect physical health. I had no physical health complications or conditions until I experienced depression. I came out of depression with 2 long-term life conditions. Now I have to deal with physical health complications as a result of my depression. I got past the depression, but I'm still left with a physical health condition. And I went in for care and I had to be educating my doctors around suicidality. I had to be educating my practitioners around the fact that I was okay dying. I had no fear of dying. You're afraid of me dying? I'm not afraid of dying, boy. You're like, oh my God, Brett, we don't want you to die, we don't want you to die. But you did not understand the experiences that I was going through that put me to that place. You did not understand that the emotional pain that I was going through was worse than the actual act of dying. You did not understand that while you're thinking of all these reasons for me to live, some of those very reasons were the triggers for me wanting to die. And so one of the things that I do a lot in my work is I talk with healthcare providers and practitioners on understanding what emotional pain is, and that the person sitting in front of you, you only can do so much for that person when they get to that place. I've been homeless. I take the public transportation system. I'm glad none of you here take public transportation, so you know what it's like. You get up in the morning and you're like, yeah, go to work, nice. And then you hit the public transportation system and, oh, I'm sorry, ladies and gentlemen, we have a delay. We're going to be delayed for next 2 minutes. And guess what? You're going to get to work 20 minutes later. Your boss is going to be mad at you. You probably lose your job. No, it does not work like that. The highest case of depression and suicide we're seeing right now are hardworking New Yorkers. Many of them are immigrants trying to make a quality of life for themselves. But the struggles of just trying to be in an environment and what we're seeing in the increased workplace bullying that's going on. We talk about bullying among kids, we need to be talking about the bullying in the workplaces. Right? You have many people working in the workplaces who are in some heartbreaking situations. I have many healthcare providers that I'm providing counseling to who are having such a hard time in the environments that they're working in the health field. So while we're focused on taking care of everybody else, and that's why the work that Lucina and I do when I started working with her, bringing my work into her practice, into her program, is focusing on emotional wellness, right? We all need to be focusing on that. We all, especially us as practitioners, we are on the first of the list of self-care. Many of us don't even know how to take care of ourselves. We're so thinking about the work we do and doing our work that we're not taking care of ourselves. And so when you look at the dynamics and how that affects the Caribbean and the West Indian community, we start to understand that even right now, with the added complications of this administration, where you cannot even have a conversation right now about we're not even going to call it names, because in my work, one of the things I do, and I say everywhere that I go and everything I do, we do call the names of certain people, because just saying the name evokes emotions, triggers the best intentions in some people, turn violent and aggressive. And so as soon as you start talking about certain things, then you start getting some of these behaviors, and we lose sight of why we're really here. We need to focus on the fact that depression, the World Health Organization in 2015 said that by 2020 depression would be a very serious health condition for us. 2015. By 2020. There is a 2030 workout plan of mental health to reduce mental health impacts across the world by 20%. The World Health Organization came back last year and said, by the estimates and reports that we have, depression is now the #1 leading health condition in the world. A year and a half later, coming back with that. We don't talk about depression in our Caribbean communities. And as soon as we start talking about that, you get people shy away from that. Oh, we're not crazy, nothing wrong with me, alright. You know what we call depression in the Caribbean? You're sad. How long can you stay sad? How long should you stay sad? And when does sad go from just an emotion to start affecting the physical issues and creating physical health complications? So as we're here at a health summit, my goal today with you is to do two things. One, to educate you on what emotional pain is. Because that's a word and a term that we're not hearing enough of, but it's really what's driving a lot of the opioid addiction, the gun violence. 60% of the gun violence in this country is as a result of suicide or someone who's suicidal. Even in the Caribbean community right now, we're seeing more cases of murder-suicides because, you know, some of the island people, we have an anger problem, you know what I mean? We're angry bad. Still can't get over the slavery and being slaves. Post-traumatic slave syndrome. And so a lot of the behaviors that we're seeing in the field are just from that whole anger and aggression of being held down, or feel like we're being held down, or feel like we needed to get more. So thank you, ladies and gentlemen, and as I said, my role here today is two things. One, educate you on emotional pain, and the second thing is for you to think about suicide from a different perspective. Suicide is not just a person dying, it's the process of how a person is living their life until they use death to end the suicide or end the mindset of the pain that they're going through. And in my workshop with you today, I'm going to go through that whole process with you for you to understand that many of us right now are suicidal and living a very suicidal life. Because even with some of the health conditions that you're talking about, diabetes, hypertension, all those things, who people know they have health conditions, they're not trying to improve their quality of life because they can't. In this city, we talk about having a lot of services, but how many of us in this city have ever tried to get help or tried to use the services and realized that it did not make it any easier for your life? A lot of times it complicated and added more stresses to your life. So sometimes when you hear someone being depressed or feeling like, you know what, I'm done, I don't even want to live anymore, I just came here as a last resort to just see if you could help me. That's the state of mind a lot of people are in right now. Okay, how do we change that? Not just coming together as a community, but changing the conversation. We need to ask people what happened, right? And how can I help you? No matter how good I am, no matter how many years I've been doing what I do, every single case that I work with of someone who's suicidal is unique by itself and allows me to rethink my approach to that person. So, thank you for the opportunity. I look forward to sharing with you today and having this conversation on a topic that we really need to be focusing on, because I'm sure many of you are hearing that in the islands, the suicide rates have gone up in the islands, right? 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 Yes. You know that Guyana has the highest suicide rates per capita in the world? Did you know that? Okay, did you know that a lot of Caribbean communities are now seeing even a higher increase after the natural storms and disasters that have passed through? You realize that?